Creating a paradoxical situation, also known as the paradoxical intervention, is a technique used in psychology and therapy to challenge an individual's perspective and create a state of uncertainty and confusion. The idea is to give contradictory or unexpected responses to a question or situation, in order to destabilize the individual's current viewpoint and potentially lead to a shift in their thinking. One example of a paradoxical intervention is in the treatment of addiction. An individual may have a pattern of using drugs or alcohol to cope with stress or emotional pain. A therapist may use a paradoxical intervention by telling the patient to continue using the substance, rather than encouraging them to stop. This unexpected response may challenge the patient's belief that the substance is a coping mechanism and lead them to explore alternative ways to deal with their issues. Another example is in the treatment of phobias. A therapist may use a paradoxical intervention by telling a patient who is afraid of heights to go to the top of a building or to look down from a high place, rather than encouraging them to avoid heights altogether. This unexpected response may challenge the patient's belief that heights are dangerous and lead them to confront their fear and ultimately reduce their phobia. A recent study found that paradoxical interventions were effective in treating patients with obsessive-compulsive disorder. The study found that when patients were asked to perform their obsessive-compulsive behaviors, it resulted in a reduction in symptoms. It showed that when patients were asked to engage in a behavior they were trying to avoid, it broke the cycle of avoidance and reinforced the idea that they could tolerate the distress caused by the behavior. In more general terms, when people are stuck in certain perspectives or thinking patterns, a paradoxical intervention can be an effective way to challenge their beliefs and open them up to new possibilities. However, it's important to note that this technique should be used with caution and under the guidance of a trained professional, as it can also be manipulative or even harmful if used without proper justification or in the wrong context. Additionally, it's important to understand that creating a paradoxical situation is not a magic solution, and it should be used in conjunction with other therapeutic techniques. It's also crucial to have a clear understanding of the context and the individual's current perspective before using a paradoxical intervention. In conclusion, creating a paradoxical situation, also known as the paradoxical intervention, is a technique used in psychology and therapy to challenge an individual's perspective and create a state of uncertainty and confusion. It can be effective in changing thought patterns and helping individuals to think differently about a given situation or problem. However, it's important to use this technique with caution, under the guidance of a trained professional, and only in a context where it's necessary and appropriate. It's also important to note that this technique should be used in conjunction with other therapeutic techniques and have a clear understanding of the context and the individual's current perspective before using a paradoxical intervention.